Greetings and welcome back. This is Iris Heath. I am actually back to talk about depression. So I know I spoke about depression last week, but I walked away recognizing, and I usually do, there's always more to the conversation when it comes to depression. Keep in mind that these videos are for informational or educational purposes only, and they're really designed to uh, hope I am hoping to encourage you to seek help if you realize you need to do so, or to assist someone who you love with seeking help. So, as I stated last week, depression is a mood disorder, and it actually can affect anyone. And some of the symptoms include sleeping too much, sleeping too little, eating too much, eating too little, isolating, not having interest in anything, not wanting to go out, having problems grooming. If you find that you're having trouble getting out of bed, and again, these are usually symptoms, in addition to some others, that occur over at least a 2 week period of time. It's actually, there is actually a difference between what we consider to be major depressive disorder and someone who experiences low mood. So there are some individuals who deal with a low mood from time to time, and it may not be clinical depression, what is termed major depressive disorder. So I ask individuals to be careful not to diagnose either themselves or someone else, to actually leave that to someone who is licensed and who has the training, proper training to actually diagnose you. Be honest when you go in with your healthcare provider. So whether it is your primary care physician, now our primary care physicians are actually assessing us in their offices, and hopefully if they recognize you need more treatment, that they are also referring you to a therapist, a psychiatrist, and so I wanted to bring additional information to ask you, if you are a part of a faith community, that is something that can be helpful. Keep in mind that may be a place where the conversation begins. Some of our faith communities, even if they have ministries, even if they have people there who are experienced in those settings, I would ask you to ask them to assist you with referring you to a professional counselor, to a licensed social worker who can actually work with you, follow up with you, and make sure that you are actually staying on top of your coping skills, whether it is support groups, whether it is medication management. And there are some individuals who actually benefit from talk therapy, which is the counseling itself, where we're actually talking, you're bringing in information, you're bringing in your symptoms, and we actually are working on that with you. I do let individuals know, my training says that if you actually know that counselor, that therapist, that may not be the appropriate relationship for you, because we want to make sure that you're actually in a what we consider to be not just a safe setting, but a non-judgmental setting, so that you can actually get your needs met. And so some individuals may need more than just talk therapy, which is also considered psychotherapy. Some individuals benefit from a medication management appointment, and I do ask some of my clients to actually have a medication management appointment with a nurse practitioner or a psychiatrist or someone licensed to write medications and follow up with them regarding that. Keep in mind that is also can be considered a second opinion about your actual diagnosis, and that professional will be able to work with you to determine what medications may help you to manage your symptoms so that you can not just feel better, but actually live better. There are a number of individuals who actually have major depressive disorder or some form of a mood disorder who work daily, and with their proper treatment, they're actually, you would not even know it unless they tell you. And that is private information, information that unless there's a reason, whether it's a legal reason or an ethical reason, that would be personal information that would be protected under HIPAA. So I want you to keep in mind that everyone who is working with you in some settings may not be licensed. Make sure that you are working with someone who is properly licensed. Ask questions. If you can actually go online to actually look up a person's license, if that is something that you feel that you need to do. There are also websites that you can get additional information, and such as NIH, the National Institute of Mental Health, NAMI, National Alliance of Mental Illness, .org. I'll put some of these things in the description, and I ask individuals to go to reputable websites, either .orgs or .gov, G-O-V, and SAMHSA. Keep in mind, if you are recognizing in yourself that you are having problems with grooming, with getting up in the morning, some people deal with grief, and that may take some time to overcome as well. And we'll talk about grief on another video. But if someone has brought to your attention or you're recognizing some of these symptoms in yourself, please take that information with you to a healthcare provider. Ask for assistance or see if you need assistance. Again, it may be something that your healthcare provider and your faith community leader can work together. That is something that can occur in some settings. Sometimes, again, our faith communities are not equipped to address these issues, and I want to make you aware of that so that you can go outside and yet continue. If you're in a healthy setting in your faith community, continue. That's a form of support that may actually help you. There are studies that show that individuals who are part of faith communities, and I mentioned it before, there are clinical studies that those individuals may actually be able to do better coming out of whether it's depression, having that support, being able to see, praying, meditating, some coping skills that for some individuals, along with treatment options and possibly support groups if you need it. Those are things that actually have demonstrated over the years to help some individuals. So please keep this in mind. Be well, and I look forward to seeing you the next time.